So symptoms of teenagers with depression: they may stay in their room more than usual. They may withdraw from friends and family. They may lack concentration. And the lack of concentration could impact on their schoolwork, it could impact on their ability to do other tasks. They may display anger or anxiety, and they could be short-tempered. They may stop caring about things, and they could be more inclined to do antisocial behaviours. They may be more tired than usual because of having poor sleep, perhaps struggling to get to sleep, or having disrupted sleep during the night, or waking up early perhaps. They may display extreme emotion, whether it's suddenly bursting into tears, or being very upset seeming, or just generally being emotional, or whether it's suddenly being angry, suddenly being anxious, or suddenly having some other kind of emotional outburst. They may have a very negative outlook on things, and talk in a way that kind of implies that they're experiencing a sense of helplessness. They're likely to have all or nothing thinking. So things are either all good or they're all bad. And things are all someone else's fault, or they're all their fault. They may display that they think that everyone hates them. Now, something that you've probably recognised is that I'm describing a teenager. So you have to weigh this up with that. What is normal for this specific teenager? If a teenager was having most of these symptoms, you would probably think maybe they're depressed, and so you might explore it a bit further. But some of these things obviously are normal. When a child becomes a teenager, they start distancing from parents, and they start associating more with their peer group. So them distancing from parents doesn't necessarily mean they're depressed. It could be part of their normal way of being as a teenager. Likewise, teenagers have a different sleep cycle to adults, and their sleep cycle generally means that they should be waking up at about 8 or 9 in the morning and not really starting the day properly until, say, 10 or 11 in the morning. And yet they're obviously expected for school and other reasons to be up much earlier than that. So it's normal for a teenager to wake up feeling really lethargic and really tired. So any one of these symptoms doesn't necessarily mean that that teenager is depressed. In fact, a small number of these symptoms wouldn't necessarily mean that. But you'd be looking at a wider cluster and the context of how the symptoms are happening. For example, a teen who is distancing themselves from their peers and from interacting with others and parents and what have you, then you might think, well, it's normal for a teenager to not want to interact with their parents, but it's not so normal them suddenly not wanting to interact with their peers. Is something going on there? So it could be something else, it could be bullying, it could be a whole host of issues. But the more of these that you see, the more it can point you to wanting to explore it further and see if it is depression or not. The other one is seeing how long-lasting it is. So a teen going through a phase for a period of time is different from a teen who, over a few months, still seems to be caught in this cycle or in this pattern of behaviour and responding. But you can always just ask a few questions. Going back to that depression checklist, you can ask a few questions and explore some other areas to see if it looks like maybe they are depressed or not. But everything that we're teaching here on this course, whether they're clinically described as being depressed or whether they wouldn't meet that criteria, doesn't matter. A lot of what we're teaching here will still work.